Hi guys, this is Dr. Nick from Central Family Chiropractic. Today I just want to talk a little bit about the birth process and in particular birth trauma. A lot of people don't realize that the statistics show that a normal natural vaginal delivery is 40 to 60 pounds of pulling and tractioning on the baby's head and neck area. When you look at C-section deliveries, a lot of parents assume that a C-section delivery is less stressful on the baby, but that is simply not true. The statistics show that a C-section delivery is 70 to 90 pounds of pulling and tractioning on the baby's neck. And when you add on a forceps delivery or a vacuum extraction, complications like a cord wrapped around the neck, those things just add on to that trauma. So what we need to put into perspective is just hearing that might not make you think too much, but the vision that I want to get in your mind is when you picture holding a baby, okay, and you hand it off for somebody else to hold, you put it down to bed or whatnot, what is the one thing that we want to guard and protect the most? Their head and neck. Okay, why? Because we don't want that area to be injured. They got a big head, they got a little neck, and it's a very delicate area. So when you put that into perspective and think of 40 to 60 and all the way up into 70 to 90 pounds of pulling on the neck, that would be equivalent to attaching a 70-pound weight to the baby's feet and picking them up by the head. Okay, so you can imagine how much stress that would put in that upper neck area. Now, a medical doctor by the name of Gottfried Gutmann did a study where he showed that on thousands of infants that he examined right after birth, that 8 out of 10 kids, 80% of children, had an injury to their upper neck area. Okay? And he concluded that if that injury were not corrected or addressed, that would compromise their neurological development and their immune system development. Well, how do those two relate? Well, to put it simply, your nervous system controls every function, every aspect of the body. So if that is irritated and stressed, then your immune system is going to be weakened. Okay? So all of these things kind of add up to prevent and inhibit the child from functioning at 100% like they were designed to. So we live in a day where kids are sicker than they've ever been. Kids have chronic illnesses. They miss months of school, staying home, being sick. 85% of kids have ear infections before the age of 1. Sinus infections, allergies, immune deficiencies, they're higher than they've ever been. And when you look at the impact that the birth trauma has to that development of the immune system, there's a very big correlation that we see every day in our office. So what are some things that you as parents could maybe notice if your child has an injury to their upper neck area from birth trauma? Well, some very common things are maybe you notice that as your kid is laying down, they always have their head turned to one side. Okay? Maybe you notice that when you were nursing them as an infant, they could nurse well to one side, but they would not latch on the other side. Colic. Colic is basically the baby's version of an adult version of my neck really hurts. I have really bad neck pain. The muscles of the neck area will clamp up to try and protect that injury, and that is a very big cause of the baby being irritable and fussy and colicky. Ear infections, those are another thing that we see big time. 85% of kids will have ear infections and so on. So if these are some things that you may have noticed with your child, if you have any questions, if you have any comments, please email us, call us. We'd love to help you out. That's what we're here for. So give us a call, get a hold of us, and we would love to get your baby in, get your child in, check them for injury to that upper neck area so they can live life at their full potential. Thank you.